My name is Dr. Uma Mahadevan, Professor of Medicine and Director of the Center for Colitis and Crohn's Disease at the University of California, San Francisco. How do you build a team? The center of your team is you. Shared patient decision-making is an important part of inflammatory bowel disease care. You should have a care team that provides competent, up-to-date care and listens to your concerns and incorporates your wishes. It's important also to be open-minded to the decisions and the options provided to you by your healthcare team. Ideally, you should have somebody who is an expert in inflammatory bowel disease managing your care. The reason for that is that IBD care is evolving every month, every year, and it's hard as a general gastroenterologist to keep up with the nuances of IBD care. While many people don't live close to an IBD center, you should have a local gastroenterologist to manage your day-to-day care. However, with the onset of video visits, which you can now do across state lines, you can find the IBD expert in your state and keep in touch with them to provide an overall management of your care. As part of your IBD team, you should have a nutritionist. Nutritionists are very important in maintaining a healthy lifestyle, in recovering from illness and building strength. A psychologist is also important, as stress has been shown to be a factor in flares, and cognitive behavioral therapy can make a difference in improving quality of life, managing symptoms, and improving overall health. Your physician often works with a team of people who are educated in inflammatory bowel disease. This can be a nurse practitioner, a physician's assistant, can be a nurse, it can be the pharmacist who's helping obtain your medications, and it can be other people within the team who have an important role in answering your questions, making sure you keep on track, and continuing to provide support. Outside of your gastroenterologist's office, you may have a colorectal surgeon. I would also advise that the surgeon you see is a colorectal surgeon who specializes in inflammatory bowel disease. The surgeries that you do should be done once and should be done well. And that's why it's important to have somebody who's experienced and who does IBD care as a routine and not once or twice a year. Finally, the other parts of your team depend on your other needs. With respect to healthcare maintenance, you may need a dermatologist to monitor you for skin cancer, a gynecologist to do your pap smears, and a good primary care provider who can make sure all your vaccinations are up to date and manage the rest of your healthcare maintenance. You are not alone in this. You have a community of healthcare providers, but you should also have a community of other patients with inflammatory bowel disease. As a provider, we can tell you what we think, but only another patient can tell you their experience of what they've gone through. There are many options out there, including Girls with Guts, to provide support and community for patients with inflammatory bowel disease. We've come a long way over the last 15 years, and we hope to continue to build on that.